Okay. Hello everyone, students. Hope you are doing fine. So you're getting ready for this exam of INICET we have within 2 weeks. So we will discuss questions, PYQs of previous topics asked from PSM for this INICET exam. So we'll start with the last year question. Okay, last exam question. Find kappa statistics. Okay, fine. So what is this kappa statistics? Is anyone? Okay, you can put it in your chat box. What is this kappa statistics? Kappa statistics measures. Okay, what does it measures? It measures inter rater or inter observer agreement. So agreement. So between two people. So what is the agreement? Is the inter observer agreement? It measures. Suppose I have some 100 ECGs are there, 100 X-rays or 100 CT scan. Okay, two people are reading. Okay, what is the agreement between these two? So that is called as kappa statistic. So maybe I have two tests being done on the same people. Okay, what is the agreement in that we measure in terms of kappa statistics? Okay, inter observer or inter rater agreement. Right now, so what is the formula for kappa statistics? Okay, so we have these two tests, TST tuberculin test and IGRS test. Okay, we have done in to find infection. Okay, in the same set of people of 200. So what is the formula to calculate? The formula for kappa statistics is that percent agreement observed, and percent agreement expected by chance by 1 minus percent agreement expected by chance. A little difficult question that was asked in the last exam. So first let us start with the percent agreement observed. Okay, so what is the percent agreement observed? So 80 out of 200 people. Okay, 80 people say that in 80 people, okay, both TST as well as IGRA said positive, and another 60 both said negative. So what is the agreement? 80 plus 60, what is the total? 200. So 140 by 200. So this comes as 0.7. So the agreement observed is 0.7. This is kappa statistics. Agreement observed is 0.7. Okay. Agreement observed. Fine. So let us find the other aspects. Okay. What is the agreement observed expected by chance? So that has to be calculated over serial of steps. So probability of both tests randomly saying yes. Okay. Both tests randomly. Okay. What is the probability of IGRA to say yes? Okay, and what is the probability of TST to say yes? Okay, find out. So out of 200 people, okay, IGRA, okay, so IGRA and 100 people it said as positive, and so this is 0.5. What about TST? So TST out of 200 people, okay, so in 120 people it said it as positive, so this is 0.6. Now, so this is a probability. We are looking in terms of probability. These are mutually non-exclusive events. So we have to use the multiplication law. Okay, so what will be 0.5 multiplied by 0.6? This is 0.3. So probability of both tests randomly saying yes is 0.3. Fine. So probability of both tests randomly saying no. So this is also in out of 100 people. Okay, so IGRA said no. And what about this one? TST in 80 people it said yes, no, out of 200 people. So we will calculate here. So 100 by 200 again 0.5. So here 80 out of 200. So this is 0.4. So what is it? Again, okay, mutually non-exclusive events. So 0.5 multiplied by 0.4, that is 0.2. Okay, 0.2. Now, what is the probability of both test agreement by chance? By chance. So then it is, we are going to use additional law of probability here. 0.3. Okay, so plus 0.2. So this is 0.5. So the probability of both test agreement by chance. By chance we are giving, based on the calculation comes as 0.5. So now we will do the calculation. Right here. So percent agreement observed. This is what the percent agreement observed. So that is 0.7. minus by expected by chance, that we calculated 0.5, 1 minus 0.5. So 0.2 minus by 0.5. So this comes answer as 0.4. So the probability, okay, of kappa statistics, okay, so we calculated is 0.4. Okay, it's not a very good amount of agreement. Okay, anything more than a 0.75 or 0.8 is an excellent agreement. So the answer for this question, the last exam, this is 0.4, guys. 0.4. Go to the next question. So the given mathematical formula, okay, is used for the calculation. This is the question that is, listen, the topic that is commonly asked for these exams is biostatistics, epidemiology, and we have this screening topic, okay, communicable disease. Okay, these are some of the areas they're giving more weightage. So the questions also framed in that way. This is also the last exam question. The given mathematical formula, it's a simple and straightforward question. Okay, yes, what is this? Yes, this is the formula of square root of summation x minus x bar the whole square by n. Okay, what is this? Is the formula for what? Standard deviation. Standard deviation. Okay, when n is greater than 30, that means sample size, you are going to use this formula. When n is less than 30, you are going to use the formula of summation x minus x bar the whole square by n minus 1. So what is variance means? What? Variance means standard deviation square. So mean, you know what is mean? Mean means average. Confidence interval. So we can calculate confidence interval. Okay, so based on 95% confidence interval for a quantitative data or qualitative data, we can calculate 1.96. Okay, so for quantitative data, it will be like this: mean plus or minus 1.96 standard L. We can calculate. This is confidence interval. It's a estimated range of values. Okay, fine. The straightforward question. The question is standard deviation, multiple times recently asked question. Last exam question. Which of the following is not useful in determining the normalcy of data? Normalcy means, okay, you want to see whether the data is normally distributed or not. For example, because you can use graphs, you can use tests, you can use when we are doing analysis. Okay, suppose as a statistician I am doing analysis, so I want to see whether to use parametric test or non-parametric test. So at the time we apply these graphs or tests. So which one will show the normalcy? Okay, fine. So these are the various graphs and tests available to say whether the data is normally distributed or not. Okay, we have this histogram. Histogram we have box and whisker plot, stem and leaf plot. Okay, and we have this PP plot, QQ plot. All these graphs will tell you whether the data is normally distributed or not. Okay, fine. What are the tests available to say whether the data is normally distributed? The tests available are the Kolmogorov-Smirnov test. We commonly use it, and Shapiro-Wilk test. These are the tests, okay, which will tell you whether the data is normally distributed. So based on that, you can go for a parametric or a non-parametric. I will go to the question. What is the answer here, guys? What is the answer here? Which of the following is useful for determining the normalcy of the data? Yes, we have this box and whisker plot, normal histogram, okay, Shapiro-Wilk test. So which one will not come here now? So we have this Mansell score. That will not be useful for finding whether the data is normally distributed or not. Man is on immunosuppressants. Recently, multiple questions have been asked in rabies. So man is on immunosuppressants, bitten by a dog. Both man and dog are immunized. Simple skin lesion is there. So the man is on immunosuppressant. Okay, if at all, if you want to start an antibiotic, what will you do? That is the question. Okay, so usually what we do following dog bite, first is you will do wound wash. Okay, you will do wound wash for what, 15 minutes, running water you do. So then you do this povidone or tincture, antivirucidal agents you will use. Okay, then you can use don't suture it. Okay, do not do immediate suturing. So wait the suturing for 24 to 48 hours. You wait for it. Okay, fine. So then you can do TT and antibiotics you can give. Antibiotics. So then based on the need you can go for immunoglobulins and anti-rabies vaccine. Category 2 means ARV. Category 3 means ARV plus anti-immunoglobulin. Now if at all antibiotics, which antibiotics? The antibiotics should cover both aerobic as well as anaerobic organisms. Okay, so better to go. What is the antibiotic? Okay, you can answer it yes. So the antibiotic you can go is amoxiclav. You can. This is the last exam question. Amoxiclav. Okay, so better to go for amoxiclav. Yes. How much population falls between median and median one standard deviation? A normal distribution curve. Okay, what are the properties of normal distribution curve or a Gaussian curve? So the properties of normal distribution curve is that, okay, fine. So basically this is the mean or median. Mean is equal to median is equal to mode. So mean plus or minus one standard deviation corresponds to what? 68 percentage. 2 means 95. 3 means 3 standard deviation is 99 percentage. Okay, this is the how much mean plus or minus 1 standard deviation, 2 or 3 standard deviation, how much it corresponds to. Okay, fine. Look here. Okay, so the question here, this is what is asked. So here it may be mean or median. Mean or median. The question is how much it corresponds. 68%. So 1 standard deviation was the question. 1 standard deviation corresponds to what? 68% of the area. So 1 standard deviation, it corresponds 68%. 2 means 95. 3 means 99. It's a, you know that it's a bell-shaped bilateral symmetrical curve. Okay, what to say? Area of the curve is 1. Maximum area of the curve is 1. Mean, median, mode, all are same. Okay, I'm going at a pace so that we can cover more number of questions. Okay, fine. Yes. Last exam question. 30K large cohort is followed up for 10 years. 50 cases develop. Rest controls have been taken. What kind of study design is this? Okay, what kind? So you are taking a cohort and followed up for 10 years. Among them you select 50 cases. Okay, rest some of them you taken as control. What study is this? So you have taken follow up also you are doing, and you are mixing a case control study also. The answer is nested case control study. First point, nested case control study is a what study? It's a cohort study. Cohort study. So when will you do the nested case control study? So whenever there is a costly investigation. Okay, so whenever there is a costly investigation to do for the entire population, costly investigation. Suppose the first step in a cohort study is that to rule out disease in the entire population. Okay, so वो practical नहीं है. Okay, so इसलिए okay we can do a nested case control study. So whenever there is a costly investigation है, so it will be very difficult. Okay, सब लोग के बनाने के लिए it will be very difficult. Okay, so that's why we can do a nested case control study. You collect data. Okay, this is the nested case control study flowchart. You take the cohort. Okay, all are free of the disease. Collect baseline exposure details. Okay, then store it. Okay, store it. Then follow these people over a period of time. Some will develop disease. This is what they say. 30K population they followed up. Among them 50 developed. They are taken as controls. Remaining disease free people you take 50 out of controls. Okay. So regarding their exposure in a case control study, regarding their exposure, so we can already collected the regarding their exposure, we already collected it. Okay, so this is the advantage. Okay, so what association it can prove? It proves temporal association. Proves temporal association. So what does it proves? It proves temporal association. That is the advantage when compared to a nested case control study. When compared to a case control study alone, it proves temporal association. Vector given in the image transmits. What is this vector? So what is this vector is that, okay, yes, it's a mite. Okay, it's a mite. We call this as trombiculid mite. Okay, this is a mite. It's called as trombiculid mite. Trombiculid mite. So what disease it transmits? It has 4 pairs of legs will be there. 4 pairs of legs. Okay, trombiculid mite. Okay, if you have any queries, you can put it in the chat box, guys. Okay, fine. So trombiculin might. Okay, so what does it transmits? Okay, it transmits what? Okay, scrub typhus. You can remember like he might run. You can remember like this. He might run. Scrub typhus. Scrub typhus, might is might only. R stands for rickettsial pox. So you can remember like she might run. So this is scrub typhus. Scrub typhus. Okay, it shows trans ovarian transmission, that is infection from mother to eggs. It also shows transstadial transmission, infection from one stage of life cycle. Okay, this might has this nymph stage. The infection, any infection getting from nymph stage, it will be transmitted to the adult stage also. That is called as transstadial transmission. Iron and folic acid for adolescent females under Anemia Mukt Bharat. Okay? So we have this Anemia Mukt Bharat National Iron Plus Initiative. It has this 6x6 interventions we do. Okay, matrix we have. Okay, so matrix. So we have these 6 beneficiaries. What are the 6 represents? 3 sixes represents what? 6 beneficiaries are there. Okay, 6 interventions we are going to do. Okay, and 6 institutional mechanisms we are going to use. So who are all the beneficiaries, guys? Who are all the beneficiaries? Okay, the beneficiaries are, okay, so 6 beneficiaries, 6 intervention, 6 institutional mechanisms we are going to use. So who are all the beneficiaries? Who are all the beneficiaries? The beneficiaries are 0 to 6 months to 6 years, months to 5 years actually. 5 years. Okay, so next is 5 to 9 years, 10 to 19 years. Okay, then we have pregnant mothers, lactating mothers. 6th one is women in reproductive age. So these are the 6 beneficiaries we have. Okay. So 6 months to 5 years, 5 to 9 years, 10 to 19 years. The question is, what is the tablet strength? For all these group, tablet strength is 60 milligram of elemental iron, a 500 microgram of folic acid. So 60 milligram of elemental iron we have and 500 microgram of folic acid between 5 to 9 years. Okay, between 5 to 9 years. Okay, so the tablet strength is 45 milligram of elemental iron, 45 milligram of elemental iron, and 400 microgram of folic acid. 400 microgram of folic acid. And for children, it is 20 milligram of elemental iron. Here I am writing 100 microgram of folic acid. So these are the beneficiaries. Okay, pregnancy, lactation, and all you have to give 180 days during pregnancy. Lactation also you have to provide 180 days. So what is the answer for this question? So the answer for this question is 60 milligram of elemental iron and 500 microgram of folic acid. It's not milligram. Okay, so microgram. It should be microgram of folic acid. Next question. Okay, this is again a question in the past, POQ only. So what is a non-parametric test? Okay, we have certain test of significance we have. So what is this non-parametric test? Non-parametric test we use when data is skewed. So whenever the data is skewed, whenever the data is not normally distributed, we should use this non-parametric test. Non-parametric test. So what is this non-parametric test means? What non-parametric test? So we have these 2 types of tests, parametric and non-parametric test. When the data is normally distributed, you go for parametric. When the data is not normally distributed, you should go for this non-parametric test. The answer is Friedman test. All these are parametric. Okay, all these are parametric tests. Okay, student t-test, okay, PSMs, ANOVA, unpaired or paired t-test. Okay, you can say it as paired t-test. A PAT-T test, all are parametric. So Friedman test, so Mann-Whitney-U test, okay, Mann-Whitney-U test, Wilcoxon sign rank test, Wilcoxon sign rank test, the Mann-Whitney-U test, Wilcoxon sign rank test, chi-square test, chi-square test, and we have this Kruskal-Wallis test, Kruskal-Wallis test, Kruskal-Wallis test. So all these things are non-parametric. That means when the data is not normally distributed, non-parametric, and the data is not normally distributed. Mann-Whitney, Wilcoxon sign rank, chi-square test, or Kruskal-Wallis test. All the following health conditions, okay, health disorders are covered under a child's health screening and early intervention program, except. So this is what we are discussing about RBSK, Rashtriya Bal Swasthya Karyakram. So 0 to 18 years we are going to screen. So we are going to look for defects at birth, developmental delay we will look for, okay, developmental delay, diseases, so deficiency, 4Ds we will look for, 4Ds. So defects, developmental delay, diseases and deficiencies. Okay, fine. Now look here. So among these are the conditions we are going to see. Okay, anemia. So we have this bite hotspots. Clinically only we can look for deficiency. Rickets, Sam child, goiter, all these things are deficiency. So congenital cataract, congenital deafness we can see, congenital heart disease we can see, any childhood disease, otitis media or skin infections are there. Okay, developmental delay. So we'll go to the question, what may be the answer here? Yes. Childhood cataract we will see, retinopathy of prematurity we will see, vitamin A deficiency we can see. So congenital glaucoma we don't see. So we don't see congenital glaucoma. You see the list here, it's not there. Congenital cataract will be there, deafness will be there. Retinopathy of prematurity is there, okay, but we don't look into the congenital glaucoma. We don't see under this RBSK, Rashtriya Bal Swasthya Karyakram. So it comes under school health checkup. Whose responsibility means recently asked question. It's a responsibility of PHC. PHC का responsibility है. तो RBSK के लिए, okay, they have to check. तो साल पे 2 बार check करना है. Severe acute malnutrition, SAM criteria XM. ये SAM criteria क्या है? Severe acute malnutrition. Okay, आप एक SAM case देख रहे हैं मतलब तो कहाँ you have to send the case. You have to refer the case to nutritional rehabilitation centers. Okay, so we have to refer the case to nutritional rehabilitation centers के लिए भेजना है. Okay, so क्या है? Okay, so SAM child का criteria क्या है? तो इसलिए वो है 3 क्राइटेरिया है. पहला वाला तो मिड आर्म सर्कमफ्रेंस लेस देन 11.5 सेंटीमीटर 115 millimeter. So this is correct. So weight below height, weight for height below 3 standard deviation, that is also correct. Pedal edema, that is nutritional edema. So what will not come here is weight for age below 3 standard deviation. Okay, so इसमें वो नहीं. So weight for age we don't take it. Okay, हम क्या है? So we take weight for height. Height लेते हैं इसमें. So weight for height below 3 standard deviation. So what is the best method to study previous research studies? Okay, previous research study. So what is the best way? So look here. So we have these various study designs. We have this case control. We have cohort. We have. So we have this RCT we have. Okay? But whenever you are finding inconclusive evidence, okay, so inconclusive evidence. So inconclusive evidence means so previous studies का result है वो inconclusive है. So based on that I cannot take some decisions. So हम क्या कर सकते हैं? Okay, so for previous studies में हम नया उसमें से नया study we can able to make it. Okay, so what are they? So whenever there is inconclusive evidence, I can do a further study. first one what I can do is that I can do systematic reviews कर सकता है. Okay, systematic reviews कर सकता है. Okay, so after that if needed, okay, so what I can do is that okay हम meta analysis कर सकता है. पहला systematic review. Okay, I can stop with systematic review also, but I can do further, I can do a meta analysis. Okay, meta analysis from previous studies. Okay, both can be done from previous studies. So out of this, which is the best one? Okay, if you ask me which is the best one, so the best one here is meta analysis. Okay, suppose I have some 10 study results are there, so those 10 studies results I can combine and make it as one result. So I have 10 results, odds ratio is there, I can merge it and I can make it as a 1 odds ratio. So that is why meta analysis is a better study. So the answer for this question is that, so which is the best method to study the previous research studies? Okay, so I can do systematic review, but out of these two, which is the best one is, answer will be meta analysis. Answer is meta analysis. Fine. Okay. So try to answer, guys, try to answer. Okay, fine, this is meta analysis. Next question. Which of the following is not the guidelines for study? This is also last INICET question. Okay, try to answer. Dr. Kirti Lakshmi, yes. So not a guideline, yes. So whenever we are doing a research, okay, for reporting, okay, there are certain guidelines. For example, so I am publishing a study on cohort study, I am publishing a case control study, I am publishing a RCT, how to report it. So reporting के लिए, so there are certain guidelines है. Okay, so हम कर सकता है. तो इसमें okay कौन सा is not, which one is not the guideline for study? That is the question. Okay, which one is not the guideline for this study? Yes. So we'll see that, then we can come back. So for RCT, whenever I am reporting RCT, I should go with consort guidelines. For RCT, I can go with consort guidelines. If I am writing a systematic review or meta-analysis, I should go for with PRISMA guidelines. I can go. Observational studies, if I am doing some observational studies, okay, case control study, cohort study, these are observational study, I can use STROBE guidelines. STROBE guidelines I can. Suppose if I am going for case reports means I can go for CARE. So case reports are descriptive studies. Meta-analysis are observational studies, I can go for MOOS studies. So I'm merging the observation studies, meta-analysis, I can go for MOOS guidelines. Diagnostic accuracy studies, for example, if I'm doing a sensitivity or specificity, positive predictive value, okay, then I can use what? START guidelines. START. This is the START guidelines. Okay, again, these are the various reporting guidelines I can do. Various reporting guidelines I can do. So now we'll go to the question. So among this, which is not the reporting guideline? Which of the following is not the guidelines for study? Not the guidelines. So not the guidelines means yes. So among this, yes, MOOS, this is correct. PRISMA, this is correct. Consort is RCT. For CARE is not for RCT. What is CARE? We have seen. CARE is for case reports, guys. CARE is for case reports. That will not be part of RCT. Vaccines, multiple times as topic areas. So we should know regarding vaccines. Each sensitive device present in vaccine to monitor its viability. What is it? It's a straightforward question. So what is this? Yes, answer it. Yes. This is what? VVM, vaccine vial monitor. Okay. So we have this VVM, vaccine vial monitor. Look at it. It has 4 stages are there. Okay. So this recently asked question also. So we have this inner white square will be there. Inner white square, outer dark circle. When the inner white square is lighter, means we can use it. So lighter means मतलब क्या है? This is white, still white when compared to the dark circle. तो ये stage 1 है, 2 है, हम use कर सकता है. Stage 1, 2 में हम use कर सकता है. तो ये है as dark है, okay, और more dark, okay. So more dark. These are stage 3 and 4. हम use नहीं कर सकता है, okay. So हम discard करना है. So what is this vaccine vial monitor measures? What it measures? Cumulative exposure to heat. Okay, so VVM measures cumulative exposure to heat, guys. VVM, vaccine vial monitor, it measures cumulative exposure to heat. स्टेज 1 and 2 हम यूज कर सकता है, स्टेज 3 and 4 हम डिस्कार्ड करना है. Discrete probability distribution that expresses probability of a given number of events in a particular time frame. Okay, suppose you have a data, so you have to present in the form of a you are going to show a distribution, so it will show in the form of a graph. Okay, so we have these various distributions are there. Suppose I have the 100 numbers are there, I am plotting it, how it comes, that is distribution. So the question is in terms of, okay, discrete probability distribution given events they are talking. Okay, fine, yes. So these are the different types of distribution. Normal distribution curve, previous questions we have seen. So it is used when the data is continuous and quantitative variable. Suppose we have this height is there, weight is there, okay, and we have this blood pressure is there. You want to plot it as a curve, it can follow this normal distribution curve. So we saw that it will be like this. This is a normal distribution. Okay, fine. This is when we'll use this data is quantitative. Quantitative means what? These are measurable data. Okay, measurable. Quantitative means measurable. Binomial distribution. Okay, only there is two events are there, two exclusive events are there. Okay, mutually exclusive. You want to show it as a graph. Okay, fine. So you put the toss. Okay, so it may be head or tail. Yes, no. Okay, so whenever there is a two mutually exclusive distribution is events are there, and you want it to present in the form of a distribution, means it follows this binomial distribution. As the name suggests, you can answer it. The answer for the question here is the occurrence of rare events, discrete data. Discrete data. So for example, occurrence of rare events in a given time frame. For example, okay, number of RTA in a highway, okay, on a highway in 2022. So particular time frame they are given. They given event is RTA. So what type of distribution it follows? Okay, so the answer for this question is Poisson's distribution. So if it's a rare event in a given time frame, means Poisson distribution. So this is answer here is Poisson distribution. So any quantitative data is so that can follow what? Normal distribution curve. Yes or no type. Okay, present, absent only. So mutually exclusive event means it follows binomial distribution. Discrete data and it's a rare data and it in a particular time frame means it follows Poisson distribution. A drug reduces mortality but does not cure the disease. Is the true statement from the following. So, drug, what is the relationship between, okay, so prevalence and incidence? So, prevalence is equal to incidence into duration. Fine. If the more duration means more the prevalence, less duration means less prevalence. So, this is drug reduces mortality but does not cure the disease. So, what does it mean? So, if it does not cure the disease means what? So more the duration means what will happen? So prevalence of the disease increases. Now what will happen to incidence? Incidence is not affected by duration. Incidence not affected by duration. So you can take it consider as diabetes. Take it as diabetes. There is no cure. Okay, diabetes, there is no cure, but we have drugs, it reduces mortality. So so automatically prevalence will be more, but the existing diabetes case does not going to help to occurrence of new cases. So the incidence is not affected by duration. This is a straightforward question. Okay, this you can answer. Human Development Index includes, okay, what is the answer for this question is HDI, Human Development Index. The Human Development Index, okay, fine. This is life expectancy at birth, per capita income and knowledge. So per capita income and knowledge. So life expectancy at birth, which country is taken as standard? Japan is taken as standards. For countries we can call India, okay, UK, Pakistan, okay. So World Cup abhi ho raha hai. So we can also calculate what is the quality of life in these countries. So per capita income, which country is taken as standards? Yes, per capita income, you can take Qatar as standards. Qatar, okay, Qatar is the standard. So knowledge you can terms of mean years of schooling and expected years of schooling you can calculate knowledge. So India comes where? So India comes in 0.645. India comes in 0.645. So any country having less than 0.55, low HDA countries, 0.56 to 0.69. 0.69. India is there, medium 0.7 to 0.79. Okay, high HDA countries. Okay, some European countries are there. So more than 0.8, equal to or more than 0.8, very high HDA. Very high HDA. We have this, Norway will be there. Okay. So other countries will be there. So very high HDA. Next question. Steps in case control study. Okay, this is an important topic, guys, as far as exams are concerned. Epidemiology. Steps in case control studies. Okay, fine. So what are the steps in a case control study? It starts from outcome to exposure. It's a quick revision, guys. It's a quick revision. Okay, outcome to exposure. Okay, fine. Now, so outcome to exposure. First, selection of cases and controls. Next is matching. Okay, then you are going to ask their exposure status. So ask their exposure status. Okay, whether they are exposed or not. Fourth is you are going to do the analysis. Okay, you are going to do the analysis. So outcome to exposure, selection of cases and controls, matching, exposure status, analysis. So here, what is the, which one will not come? So inference will come, selection will come, matching will come. So we are not going to do follow-up because both, it goes from outcome to exposure, guys. So there is no follow-up here. Okay, there is no follow-up. So it goes from outcome to exposure. So since there is no follow-up, so what is the answer for this question? 2, 3 and 4. So follow-up will be done in which study? Follow-up will be done more in a cohort study, not in a case control study. Best study to find the strength of association. Okay, so best study to find, this is a past question. So if the question starts, okay, the strength of association, okay. So out of relationship, any relationship, best study first is meta-analysis. Meta-analysis. Second is systematic reviews, we can see. Okay, third is RCT. Fourth is some amount of quasi-experimental studies are there. Quasi-experimental studies. Fifth, we have cohort. Sixth, we have case control. So these are the various studies we can see as a terms of strength of association. So what is the best possible answer here? Okay, so we can go with what strength of association. So the first four, it's not there, it's not there, not there. So what is the best possible answer? We can go with cohort study. How will you find strength of association in a cohort study? Is you can find relative risk. Okay, but in a case control study, you can find odds ratio. Cohort study relative risk, case control study, you can find odds ratio. Match the following. So answer this question. What is the answer? The question that is given here is we have is box and whisker plot. Okay, box and whisker plot. We'll see here. So look here. This is box and whisker plot. Okay. The central value is the median. This is what we call it as median, guys. This is what we call it as median. Now, the median is in middle. If it is in middle, now this is normally distributed. Normal distribution. Okay, so as a dictum I said, okay, median and skewness in opposite direction. You can remember like this. Okay, so median and skewness will be there in the opposite direction. Now look here. So this is positive side, this is negative side. This is positive, negative side. Now median is at the top. median is in positive side. What skewness is this? Already told you, median and skewness is there in the opposite direction. So median is there in positive side. What does it mean? Okay, so that means you can say it as this is left or negatively skewed. Left or negatively skewed, because tail is there in the skewness is there in the opposite side. So median and skewness will be there in the opposite direction. As a dictum, I want you to remember. To answer this question, this is how we can go. Okay, fine. If median and the tail, so we'll go again, sixth one. Next. Okay, so median is here. Median is there in the negative side. So what does it mean? Yes, median is there in negative side. What does it mean? Yes, this is right or positively skewed. This is right or positively skewed. So median and skewness in the opposite direction. So based on that, you can answer this question. Median is there in the middle, so it means what? It is normally distributed. Look here. First one, it is in the middle, normally distributed. These are called as outliers. Okay, these are called as outliers. So these are extreme value in the data. So that these are outliers. So this is in the positive side. So this is in positive side. What does it mean? So median is there on positive side. This is negatively skewed. This is in negative side. So overall, this is what? Positively. So what is the best answer here? Answer. Yes, what is the answer here? The first one is normal, outliers, negatively skewed and positively. So the answer for this question is C, guys. The answer for this question is C. Next. Standardized age mortality is an indicator for. So we have this. We cannot compare crude death rates. Okay, first point. So crude death rates, CDR, cannot be compared. You cannot compare it. Okay, why? Cannot be compared. Why? Because of difference in age distribution. Difference in age distribution. You cannot compare crude death rates because of difference in age distribution. If you want to compare, what you should do? If you want to compare, what you should do means you can use standardization. You can use standardization. A technique is there. Standardization. So you take age specific deaths. Okay, you take the age specific deaths, age specific population. The age wise deaths and age wise population. Okay, so suppose you have 10 to 20 years. What is the population? What is the death? 20 to 30 years. What is the population? What is the death? So this, if it is available, you put it in the standard population. Standard population. This is called as direct standardization. So we have a population called as standard population is there. You have this age wise deaths, age wise population, you take it. So while you do the calculation, that apply it to the standard population. If you do this, this is called as direct standardization. So what is the question? What is the question here? Standardized age mortality is an indicator for. So what does it do? Standardized age mortality indicate for what? Population, death rate of the population adjusted to the standard age distribution. Not sex. This is not sex. The age structure. Okay, fine. To remove bias, all are correct only. So all are wrong only here. So so this is the answer. Okay, death rate in the population adjusted. Okay, to a standard age distribution. So whatever population we age wise deaths, age wise population we have, we can apply it to the standard population and we can do the calculation. We have this indirect standardization is there. Indirect standardization, indirect method, we calculate this SMR. We calculate SMR called as standardized mortality ratio. Standardized mortality ratio in any population. What is the formula to calculate is what is the observed deaths? What is the observed deaths by expected death? So this we call it as indirect standardization. But the question is what? Direct standardization. Okay, direct standardization. Okay, so whatever you calculate, age-wise population, deaths and population we have, so take it and apply it in the standard population. Based on that, you do the calculation. These are straightforward question. Answer it, guys. Answer it. Okay. So match the following. Okay, for Japanese encephalitis, what is it? JE. JE is common where? JE is common in rice growing areas. Okay, JE is common in rice growing areas. It is common. So we have this 𝐒𝐿𝐿𝐿. 𝐒𝐿𝐿 is what? 𝐒𝐿𝐿 is the vector. 𝐒𝐿𝐿 is the vector. We have this 𝐒𝐿𝐿 fatigans we have. Okay, 𝐒𝐿𝐿 fatigans is the vector. Man is what? Man is the accidental host. Fine. Man is the accidental host. Pig is what? Okay, pig is the, okay, so pig is the amplifier host. Okay, pig is the amplifier host. Ardid birds are the main reservoir. Okay, they reservoir. Okay, so where multiplication happens. So 𝐒𝐿𝐿 A is 4. A is 4. B is, a man is accidental host. B is 1. Pig C. C is 3. Okay, D is 2. So this is the answer, guys. This is the answer. So this is usually where common means it's rice growing areas. Okay, rice growing areas. It's not 𝐒𝐿𝐿 fatigans. Okay, sorry, that is 𝐒𝐿𝐿 𝐿𝐿. 2 is there. 𝐒𝐿𝐿 Vishnui is 1. Okay, that in North India. The second one is 𝐒𝐿𝐿 𝐿𝐿. Okay, this is transmits, okay, in South India. 𝐒𝐿𝐿 Vishnu is the vector in North India. 𝐒𝐿𝐿 𝐿𝐿 in the South India. Japanese encephalitis, rice growing areas, it is common. Next question, guys. So try to answer this. What is external validity means what? What do you mean by external validity? External validity. Is anyone? External validity means, first, what is validity? How accurate the study is. How accurate. So we have these two types of validity will be there. Internal validity, external validity. Internal and external validity. Okay, internal validity means, okay, free of a bias. Okay, we have this, it should be free of errors actually. Okay, so as free of bias, any systematic errors. Okay, confounding factors are there. Okay, errors, free of errors. Okay, then it becomes internal validity. The internal validity means how accurate. Okay, so how the study is done properly. So that should be free of bias or free errors or any errors, confounding factors. Okay, that is called as internal validity. What about external validity means what? What is external validity? Look here. So whenever we are doing a study, this is the population. Okay, from the population we take a sample and whatever results we are going to get, हम क्या कर सकते हैं? Results के इसके बाद वे क्या कर सकते हैं? तो results को हम क्या कर सकते हैं? So we can generalize it. Generalize it. Okay, so what you do? You do a study in some 100, 200 or 300 people in a city, and whatever results we are getting it, हम क्या कर सकते हैं? उसको generalize कर सकते हैं. Okay, so this result is applicable to the whole population. The same thing. Okay, your mother cooks rice. Okay, she is cooking rice. She also generalize it. So she wants to know, oh, rice boil ho gaya. Okay, what she does? So she takes one piece of rice. Okay, and what she does? She checks it whether rice boil ho gaya nahi. So uske baad kya hai? What's her assumption? She generalizes it. What she does? So she generalizes that the whole pot of rice is boiled. Whole pot of rice is boiled. This is called as external validity. The external validity hai, so whatever results we are getting, we can generalize it. Internal validity, whether the study is done properly or not. Okay, is it free of mistakes? Is it free of errors? Is it free of bias? Is it free of confounding factors? So that is called as internal validity. Next question. In recent years, incidence of non-communicable disease like diabetes and hypertension have increased. So this is an example for what? Okay, recent years we have this study. So what is this? Yes, this is, so suppose in last 20-30 years, for example 2000 to 2023, okay, so gradually the diabetes cases are increasing. So this is a trend of the disease. So over a period of time, trend of the disease over a period of time. So what is this? What type of, is it seasonal? Is it cyclical? No, this we called as long-term trends. This is called as, answer is secular trends. Secular trends. It shows a trend. Okay, what is the trend of diabetes? Recently it is diabetes and non-communicable disease are increasing. Which one is decreasing? Communicable disease are decreasing actually. Emergency contraception commonly used. Okay, so we have this. What are the emergency contraception methods available? This is one. Levonorgestrel pill you can use. Second, you can use OC pills. You can use. Okay, fine. Third, you can use OC pills with high estrogen dose. You can use high estrogen dose. You can use. Third. Fourth, you can use what you can use. Fourth one. What you can use is mifepristone. Okay, mifepristone. Fifth, you can use is IUCD. You can use IUCD. Okay, so now IUCD. So out of this, here, okay, which is the most commonly used? Okay, emergency contraception commonly used. India में क्या commonly use कर सकते हैं? So we are using this in the program. Levonorgestrel, this is used in the program. The name is easy pill. Okay, so you have to give 2 tablets. We have to provide. Okay, so 0.75 milligram. Okay, the tablet is 0.75 milligram tablet. So 2 tablets you have to provide. 12 hours gap. So within 72 hours of unprotected sex. 72 hours of unprotected sex you have to provide. Okay, 2 tablets. So as a doctor you can prescribe the clients coming to you. Even in the program called as easy pill. Yes. Next question. You are a medical officer, okay, at a PHC. 50 patients requiring antihypertensive drug are being transferred to a PHC from periphery. So you have a new patient requiring new 50 patients. Out of this, 40 people need amlodipine. 10 people have contraindication for amlodipine. They have to start another drug. Okay, lisinopril. Okay, fine. The drugs will come at PHC. Okay, once a month. Monthly basis, you will get the drug. How many drugs will you order combined? What will be the reorder factor? Okay, so look here. So so we have 50 patients. We have 50 patients. So both 50 patients, okay, 40 patients require amlodipine and 10 patients require lisinopril. Okay, anyway 50 patients. Okay, so 50 patients. This you would have practically we can do. Okay, so as an intern, if you worked in PHC, okay, so this is management. Okay, there you could have learned. Okay. So what is this reorder factor is what? So I have 50 patients. So 30 days. So 30 days I have to order. Okay. So 30 days. So 1500. Okay. So sometimes 31 days we have. Okay. So for that we have this additional 2 days we can add. So plus 50 plus 50. So 100. So this is 1600. 1600 tablets I have to order. Okay. Fine. Now plus additionally what we say, what is the reorder factor? We are getting the drug monthly. So monthly basis, okay, supply is monthly basis. So you have to multiply it with 2. You have to multiply it with 2. So 1600 and the multiplication factor what we have is 2. So if it's 3 months means I have to order for 6 months. So to 1 month stock I need to have. Okay, 1 month stock I need to have. So 1600 tablets I will have. And again additionally 1600 tablets I will have. So totally 3200 tablets will be this. So reorder factor is 2. The answer for this question is 1600. The reorder factor is 2, guys. Match the STD colored kits with their numbers. This is a repeated question. So we have these various colored kits used in this Suraksha clinic we use. Okay, Suraksha clinic. Okay, and we have, this is called as syndromic approach. Okay, we call this a syndromic approach we call. So what is this colored kits? Okay, white color kit where will you use? Okay, fine, white color kits. The white color first is gray color, usually gray color. So gray color, so this is, you will use urethral discharge. Green color is vaginal discharge, a vaginal discharge, green color. So white is what? Okay, so white is genital ulcer disease, genital ulcer disease, genital ulcer disease. And yellow we use it for lower abdominal pain. We have red is there, red is for GUD, painful GUD we'll use. Black will be there, black we can use it for inguinal buboes, we can use black, we can use it for inguinal buboes. This is also multiple times a repeated question. Okay, black inguinal buboes. So what is the answer here? So one is white, A, A2, B1. Okay. The answer is this. Syndromic approach, Suraksha Clinic, what we use. Among the following nutrients, okay, lactating mothers required more as compared to pregnant females. Straightforward question. As a supplement, which one you want to give? Okay. So the straightforward, you can give calcium and vitamin A, both are required more. But as a supplement, look here, calcium in pregnancy for normal adults is 1000 milligrams, lactation 1200 milligrams. Vitamin A, okay, it comes in micrograms. As a supplement, you don't give actually 950. So if I want to choose a better one, okay, folic acid and all, it comes down. Okay, so 570 in micrograms in pregnancy, lactation it is 330, and iodine it is what? 250 micrograms, lactation 280. Right. So if the question very specifically as a supplement, which one will you give more? Okay, so better answer will be what? Better answer will be calcium. As a supplement, you have to provide extra additional tablets. Pentavalent, straightforward question, guys. Okay, so what is pentavalent? So pentavalent vaccine, it is used for five diseases includes, okay, DPT, hepatitis B, H influenza B. DPT, hepatitis B, H. When it is given, okay, when pentavalent is given, 6, 10, 14 weeks, 0.5 ml, IM you can provide, maximum 1 year, guys, not more than 1 year. So pentavalent in the National Immunization Schedule, maximum it can be given for 1 year of age. Next question. This is also a repeated question, okay, past question only. Okay, so a study was conducted to see the effect of pulse oximeter readings in neonates with and without microphone. So a plot between two values are shown. Some values they are shown. What is this graph first? First you tell me, what is this graph? Yes, this graph is called as scatter diagram. Okay, this graph is called as scatter diagram. What does this will tell you? Okay, so you have two variables you take. So you take this independent variable in x-axis. So we have these two variables, independent variables. Suppose age you take, for example, age. On y-axis you take it as dependent variable, dependent variable. For example, weight you take, body weight. So what does this shows? As the age increases, what is also increases? The body weight is also increased. So what does it mean? So that means, what does this scatter diagram or correlation talks about? It talks about relationship, strength as well as a relationship between two variables. Strength, relationship between two variables. The relationship between two variables. So as the independent variable increases, the dependent variable also increases. So what does it mean? So if one variable increases, the other variable increases, means this is positive correlation. Positive correlation. This is positive correlation. If I increase one variable, the other variable increases, positive correlation. So for example, look here. So I'll plot another one. Okay. Suppose age and forced expiratory volume. As the age increases, the forced expiratory volumes comes down. What is this? This we call it as negative correlation. So one variable increases, the other variable decreases. This is, we call it as negative correlation. Correct statement regarding the following. Sensitivity depends on prevalence. I don't think so. Specificity depends on predictive value. No. So what commonly that is asked here is that positive predictive value depends on prevalence, guys. Straightforward question. We can do the calculation also, I can show. Okay, so look here, the relationship between positive predictive value. So positive predictive value is directly proportional to prevalence. So more the prevalence, more the positive predictive. So you do a test, positive predictive value at a PHC, okay, at a tertiary care center. Okay, so where it will be more. Okay, so the positive predictive will be more in the tertiary care center. So next is prevalence negative predictive value, inversely proportional to prevalence, that they won't ask commonly. The relation is that positive predictive value and prevalence. Okay, the more the prevalence, more the positive predictive. As the prevalence increases, the chance of false positives will come down. False positives will come down. So automatically, what will increase means the positive predictive value will increase. Which are the following are key features of Kangaroo mother care? Okay, Kangaroo mother care. Okay, this is done for low birth weight babies. This is started in low resource countries of low birth weight babies. Increase the low birth weight babies survival we did. Okay, to improve the low birth weight baby survival we did. Okay, so fine. So what are the four components? First is skin to skin positioning. Put the baby on mother's chest. Put the baby. Now dresses are available. You put the baby on mother's chest. Second, exclusive breastfeeding. If you do these two, what will happen? Automatically weight gain will be there. So automatically weight gain means so they can early discharge from the hospital. You can think that why can't we put in NICU and all? Look here. The NICU is highly infectious area. So don't put babies in our countries, which is limited resources. We can't put all the low birth weight babies in the NICU. So this is an easy way to improve the survival. We started this. So along with the help of WHO. Okay, so put the baby on mother's chest. So exclusive breastfeeding. So what will happen? Weight gain will be there. So once there is a weight gain, so early discharge from the hospital. But they require support in the community. For that, what we do is the health workers will go on visit. So we have this home-based newborn care is there. Okay? So in that context also they can go on visit. So what is the answer here? Skin to skin positioning, exclusive breastfeeding, early discharge, guys. Early discharge from the hospital. What is triage? Triage we do following a disaster. Okay, suppose there is an earthquake is there. Suppose some form of disaster, floods are there. So triage is not based on first come first treated principle. It is based on the severity of injury and the likelihood of survival. So we have, whenever there is a disaster is there, hospitals will be full. So you have somewhere you have to do the triage. Even COVID times, okay, we were doing triage. Some parts of India it is done properly. Some parts they could have done better. So for what is this triage? It should be done at the site of disaster. So we have to do at the site of disaster. 4 color codings we have to follow. Red means the person is what? Is high priority. Yellow means medium. Okay, green means ambulatory. Black means okay, yellow means medium priority. Red means high priority. This is triage. You should do at the site of disaster. Flow cytometry. Okay, so it's plotted through. Okay, flow cytometry. Okay, immunocytochemistry is what data? Yes, these are the examples for quantitative data. Okay, quantitative data. So what are the graphs we can use? Quantitative data we can use histogram. Okay, so we can use frequency curve. You can use. Okay, histogram, frequency curve, frequency polygon. You can use. A line diagram we can use. Line diagram. Okay, box and whisker you can use. Okay, box and whisker plot we can use. We can use what to say, dot plot you can use, scatter plot you can use, scatter plot. Now tell me among these which are the graphs that is present here. Okay, so better line diagram may not be better. So what I would say is that the line diagram means that time has to be there. This is for quantitative data, so the better answer will be histogram and dot plot, guys. Histogram and dot plot. This is a dot plot. Okay, quantitative data you can use it. This is a histogram. This you can use. Line diagram option was there. Line diagram is more for time should be there. If time is there, we can go for line trend of the event over a period of time. Otherwise, histogram and dot plot will be. Regarding the equivalence of margin graph, consider the following statements. Okay, let us see here. So this is the graph they have given. This is the graph they have given. So here they said that suppose we are doing a RCT. So we can do this different type of trials we have. Inferiority trials, equivalence and non-inferiority trials. But they have shown these two statements they are given. Okay, fine. This is new treatment is worse, new treatment is better. Okay, fine. Various studies they are showing, and they said benchmark means somewhat equivalent. Both the drugs are somewhat equivalent. So we have various studies as A, B, C, D and D, E, F, G, H, I. Okay, it is there. Okay, among this, okay, let us see here. So the new treatment is better. Okay, so they are given the results in the form of a range. The results they are given some, or let us assume it's odds ratio with 95% confidence interval. Let us assume they have given. Okay, so this is first treatment A. So the entire range is within the new treatment is better. Okay, new treatment is better means this is in the range, this is in the range, these three are. Okay, fine. So these are, they comes to new treatment is better because they are not touching the benchmark also, they are not touching. What about D? What about D? It is touching here. It is touching here. So this comes in benchmark. Okay, fine. So these three will come here in the benchmark. And what about this one? The new treatment is worse. D is there, H is there, I is there. All three shows that new treatment is worse. I will go statement wise. We will go first statement wise. We will go. 1 year represents superiority of the new treatment. That is correct. This is A, superiority. I represents inferiority of the new treatment. So it shows obviously the new treatment is worse. Okay, fine. This is also correct. E represents non-inferior treatment, that is somewhat equivalent. Okay, they neither not superior nor inferior. Okay, somewhat equal. Okay, similar. Okay, so this is also correct because it is there within the range. Okay, fine. C is inconclusive. C is not inconclusive. C is actually superior. C is actually superior. So this is the wrong state. So what is the answer here? 1, 2 and 3. The answer is 1, 2 and 3. So the diagram itself will show. Okay, you need not know the subject, but you can answer it actually. So some are given within the range of superior, some are is given within the range of worse. Okay, some are as equal. Okay, if the range touches the line, then it is obviously that it becomes benchmark or superior or inferior. You can answer this, guys. What is the next question? Yes, the most common mode of absorption in inorganic lead is. So we have these two types, organic and inorganic lead. The inorganic lead is commonly where we will see is the battery industry, shipbuilding. Okay, battery industry. These are the areas you will see inorganic lead. So basically the most common route is inhalation. So they have these symptoms will start. We have this what we have. So abdominal pain will be there, constipation will be there, wrist drop will be there, foot drop will be there. The blue line will be there in the gums. It's called as what? Called as Burtonian line will be there. Fine. What about organic lead? Organic lead is most commonly skin absorption. Organic lead is mostly skin absorption. Skin absorption is organic lead. And what symptoms it can cause? It can cause, we have this CNS symptoms it can cause. CNS symptoms. These symptoms will start when the blood lead levels are more than 70 microgram per deciliter. For inorganic lead, symptoms will start appearing. For we already said this wrist drop, foot drop will start. Which are the match the following scientists with their what is their discovery? Okay, fine. We can answer it easily. The past NEET question only. not INA question only. Okay, so Walter Reed. Okay, so Walter Reed contributed for what? Yes, he contributed for yellow fever. Edward Jenner, smallpox vaccination. James Lind. Okay, he conducted the first trial for first kind of RCT. We cannot say that RCT. He conducted some trial. He conducted for scurvy. So people traveling in ships. Okay, ships, they are having this scurvy because lack of fresh fruits. So what he did, okay, so different set of people, he given treatment for different products. So the people who consume lemon, okay, so for among them scurvy was not there. Okay? That was first kind of some form of experimental research. So what is the answer for this question? So 1B, 1B, 2C. Okay, answer is this one, guys. Answer is this. Next question. Let us see the next question. A 5-year-old Ram and 3-year-old Sham were Rama Devi's sons. Okay, fine. Sham developed rash, but Rama Devi ignored it. Okay, so two sons are there. So first, okay, so dusra wala Sham. Okay, 3-year-old Sham developed rash. Rama Devi ignored. After 10 days, Ram also developed rash. After 10 days, Ram also developed rash with fever. Out of fear, Rama Devi took Ram to the PHC and healthcare workers suspected measles. Okay, choose the correct option. Okay, first, what are the things we should know? So what is a primary case? Primary case now, first case. Primary case means first case. Okay, here first case is in the community. That is the primary case. What is index case? First case to the health provider. First case to the health provider. Now tell me which is the primary case, which is the index case. So which is the primary case? Primary case is what? Sham is the primary case. That is correct actually. Sham is the first person who developed the rash. Okay, fine. Second. And second is that, let us assume that's a primary case is still there. And Ram is the index case. Okay, Ram came to the health provider. That is also correct. Ram is the index case. So what is the incubation period of measles? Measles incubation period is 10 to 14 days. After 10 days only Ram developed the rash. Probably Ram got infection from Sham. That is also correct. Okay, fine. Ram got infection from Sham. That is also correct. Ram could have got post-exposure prophylaxis if the mother brought him on time. So look here. So following exposure, okay, we have to provide within 3 days. Within 3 days of exposure, okay, you can provide vaccine, guys, in terms of measles to prevent the disease. The disease incubation period is 10 days. For vaccine incubation period is 7 days. So within 3 days, if the mother is bringing the child to the hospital, we could have given the vaccine, we could have prevented. Actually, the fourth statement is also right. All the statements are right. So answer is 1, 2, 3, 4. So Sham is a primary case because he is the first case. So Ram is the index case because he came to the health provider. Ram got infection from Sham. That is also right. Okay. Because 10 days incubation period was there. This could have been prevented if you would have given the vaccine. If you would have given the vaccine within 3 days of exposure, we could have prevented. That is also correct. False statement regarding rabies immunoglobulin. So we have these two types of immunoglobulins will be there. Okay, human, equine. Human is 20 international units per kg. Equine is 40 international units per kg. Should be started as early as possible. Should not be given after 7 days. That is also right. Human rabies immunoglobulin is not available. You can go for equine. This is also correct. Is given exclusively in deltoid. No, half the dose we should be giving at the site of bite. Half dose at site of bite. Site of bite. Remaining half dose in other areas. Okay, so there is no exclusively and all. No, nothing. Okay, the half dose should be there at the site of bite. A point of care diagnostic test sensitivity is 98%. It was a negative result. Okay, fine. What does this imply? How to interpret the results? Look here, a highly sensitive test. A highly sensitive test which result to take. Which result to take. A highly sensitive test, the positive result doesn't matter. So we have to take the negative result. Negative result means less likely to have. So in a highly sensitive test, okay, so you positive test doesn't mean the person will have the disease, but negative test means less likely the person will have the disease. In a highly specific test, take the positive result. Highly specific test, you have to take the positive test. Positive test, you have to take a highly specific test. Highly specificity. Specificity means ability to identify the true negatives. A highly sensitive test means ability to identify true positives. So in a highly sensitive test, if there is a negative result, means more chance that the person will not have disease. Highly specific test, if it's positive, means more likely the person will have the disease. I will go to the question. 98% negative result. Okay. So negative test, what will you do? Okay, so test same, another point of diagnostic test. Okay, the patient is less likely to have the disease. If you see it, the patient is less likely to have the disease. Next question. Attributable risk calculated to understand the relation between smoking and lung cancer is 90%. What is true? Attributable risk talks about what? How much percentage of disease attributed to the exposure among exposure is percentage of disease attributed to exposure among exposed. Among exposed. The question we have to very specifically say among exposed. Okay. The second one is there called as population attributable risk. Population attributable risk. What does population attributable risk says? How much percentage of disease, okay, attributed to the exposure in the population. Attributed to the exposure, the population. So the two are different. Attributable risk talks about only the exposed people. Population attributable risk talks about the population. Okay, fine. Now we will see the answer. What is the answer here? So 90% of lung cancer cases can be eliminated if in population smoking is eliminated. Yeah, actually this is population attributable risk. What is the answer is this. Yeah, attributable risk is 90%. What is the 90% of lung cancer is eliminated in smokers if smoking is eliminated. We are talking only about the exposure among exposed, not everyone guys, only exposed. Following an earthquake, building codes are changed to earthquake resistant buildings. Which are the following steps, okay, in disaster management? This falls. So we have these various ways. Okay, so first will be impact, will be the impact. Okay, then we have this response phase. People will come and respond for the disaster. Then relief phase. Then we have this reconstruction. Then we have this rehabilitation. So all are done after disaster. But the question is here, okay, what will you do? Okay, for building codes were changed to make it as a earthquake resistant building. In future, if the earthquake happens, so we want to reduce the impact. So we want to reduce the impact of the disaster. What is called as? This is called as disaster mitigation. Okay, so if again disaster happens, okay, I want to reduce the impact of the disaster. This we call it as mitigation. Contraceptive failure is assessed using which are the following methods? Contraceptive answer is straightforward, Pearl index. So we have these two methods available. One is Pearl index. Second is life table analysis. Out of this, which one is better? Yes, obviously life table analysis is the best one. What is the formula for Pearl index? The formula for Pearl index kya hai? So accidental pregnancies by total months of exposure, total months of exposure multiplied by 1200. तो accidental pregnancy जो भी है, so for example, okay, हमारा पास okay 100 women है, तो 100 women practicing some contraceptive practice कर रहा है, तो among them okay for एक साल का contraceptive practice कर रहे हैं, so उसमें तो 10 pregnancies हो गया, okay, so अभी pearl index क्या है, तो क्या होता है, तो accidental pregnancies कितना है 10, टोटल मंथ्स ऑफ एक्सपोजर कितना है, सो 12 महीने, बट वो 12 महीने एक ही वुमन का, फॉर वन वुमन, ओके, सो हमारे पास कितना वुमन है, तो हमारे पास ओके सो 100 वुमेन है, तो इसने लिए क्या है मल्टीप्लाइड विथ 100, so this is also 1200, this will cancel each other, so 10, so 10 is the Pearl index, okay, so if 100 women use a contraceptive for 1 year, among them 10 pregnancies can happen, guys. So water from broken septic tank is collected in a container. Breeding mosquitoes are seen. What is this larva? Okay, this is broken septic tank. This is dirty water. You need not to know also dirty water image. So we have this siphon tube is there. So what is the clue? So this is what? This is 𝐒𝐄𝐈𝐀𝐋. Okay, 𝐒𝐄𝐈𝐀𝐋. Okay, the question is artificial container. The question is artificial container means what will be your answer? ओके आर्टिफिशियल कंटेनर है मतलब ओके एडीज हो सकता है, फ्रेश वाटर मतलब क्या है, फ्रेश वाटर मीन्स अनोफिलिस हो सकता है, ओके आर्टिफिशियल कंटेनर मतलब एडीज हो सकता है, तो ये मस्कीटो उधर ब्रीड कर सकता है, फ्रेश वाटर अनोफिलिस मस्कीटो, तो एडीज मस्कीटो आर्टिफिशियल कंटेनर वो टायर्स है, वो क्या है कोकोनट का शेल होता है, में ब्रीड, एयर कूलर्स में ब्रीड कर सकता है, ओके उसमें पानी है उसमें ब्रीड कर सकता है, फाउंटेन्स में ब्रीड कर सकता है, तो मैंसोनिया कहाँ ब्रीड कर सकता है, मैंसोनिया वो क्या है एक्वाटिक प्लांट्स है, वाटर विथ एक्वाटिक प्लांट्स है, तो वही वाटर में वो ब्रीड कर सकता है एक्वाटिक प्लांट्स. Straightforward question, guys. Okay, it's in past PYQs. Okay, so what is this? The artesunate sulfadoxine pyrimethamine combination. What is this? This is malaria. Which malaria? The question is very specific. Falciparum malaria. Okay, falciparum malaria हम दे सकता है. Okay, ठीक. तो ये वाइवैक्स में क्या क्या दे सकता है, ओके वाइवैक्स में हम क्या देते, तो हम क्लोरोक्विन देते हैं, क्लोरोक्विन, ओके 3 दिन के लिए हम क्लोरोक्विन देते, प्लस क्या है प्राइमाक्विन, क्यों प्राइमाक्विन फॉर 14 डेज, गिव इट फॉर 14 डेज टू प्रिवेंट रिलैप्स. फाल्सीपैरम में ACT वो पिक्चर है ना, वो पिक्चर फाल्सीपैरम के लिए दे सकता है, सो फाल्सीपैरम और क्लोरोक्विन के लिए रेसिस्टेंट हो गया तो हम नहीं दे सकता है, तो इसलिए फाल्सीपैरम में हम ACT प्लस प्राइमाक्विन 1 दिन के लिए देते, 1 दिन फाल्सीपैरम. तो सब पे क्वेश्चन पे पूछ रहा था, तो फाल्सीपैरम नॉर्थ ईस्टर्न स्टेट्स पे वो असम, मिजोरम, मणिपुर, ओके नॉर्थ ईस्टर्न स्टेट्स में वो रेसिस्टेंट शुरू उधर ही होते हैं, ओके कॉमनली. द क्वेश्चन वेरी स्पेसिफिकली दे आर आस्किंग, ओके फाल्सीपैरम नॉर्थ ईस्टर्न स्टेट्स, देन हम क्या कर सकता है, ओके सो वी कैन गिव इज लुमीफैंट्रिन, ओके एंड आर्टीमीथर, ओके ये दोनों ड्रग हम दे सकते हैं, लुमीफैंट्रिन प्लस आर्टीमीथर. In a case of HIV/TB infection, what is the next step? Okay, usually कोई infection है हम पहला क्या दे सकते हैं? Okay, so first we start with ATT, then after 2 weeks ART. So what is the answer here? The answer, you give ART then ATT, it can go for IRIS. What is IRIS क्या है? Immune reconstitution inflammatory syndrome. Okay, so reconstitution, immune reconstitution, inflammatory syndrome. So that is why we have to start with ATT. After 2 weeks, you can go for ART. After 2 weeks. This is the last question. Intussusception is seen in which type of following vaccine? Okay, normally. So the answer for this question is what? Rotavirus. Normally, rotavirus is given 6, 10, 14 weeks. Maximum 1 year हम दे सकता है. It is given orally 5 drops. Given orally 5 drops. But the first dose, okay, avoid after 12 weeks. That is what the question is. First dose, okay, avoid after 12 weeks. It can be given till 1 year, but don't give the first dose after 12 weeks, because if you give the first dose after 12 weeks, okay, this is, it can go for intussusception. Okay guys, hope you learned something. Okay, look here, the key topics for this this INICET, usually last exam also. So they ask more in biostatistics, epidemiology, screening, okay, and communicable disease, vaccines. These are the areas they are focusing. Okay, please revise it. Okay, these questions, go through the questions quickly. Okay, hope you learned well. Okay, so all the best for exams, guys. Okay. See you with the recall session. Okay, thank you, thanks for listening.